For military retirees, turning 65 ought to be a celebration, a milestone you've absolutely earned. But for thousands, it turns into a nightmare. There is one critical mistake that can cause you to lose your TRICARE benefits, and you won't even see it coming. This isn't some minor hiccup. It's a catastrophic error that can leave you without the health coverage you've counted on for your entire career, saddling you with shocking bills and lifelong financial penalties. This isn't about some obscure loophole. It's a fundamental rule that is tragically easy to get wrong. In this video, I'm going to show you exactly what that mistake is, why so many people make it, and how you can guarantee your TRICARE for Life is activated on day one, protecting you and your family. Stick with me because the next few minutes could save you from a devastating and costly loss of benefits. Here's the heart of the problem. The number one mistake we see military retirees make every single day. They assume that because they have TRICARE, they don't need Medicare. It sounds logical, right? You've had TRICARE for years, maybe decades. It's the healthcare you know. You earned it. So why on earth would you sign up for another government healthcare program and pay another monthly premium? This is the dangerous assumption that leads to disaster. What isn't always made clear is that the TRICARE you have before you turn 65 is not the same as the TRICARE you have after you turn 65. The system is designed to change, and if you don't take one specific action, your coverage doesn't just change, it can vanish.
The critical mistake is this: failing to enroll in Medicare Part B when you become eligible. Your old TRICARE plan, whether it's Prime or Select, isn't designed to be your primary health insurance forever. It ends when you become eligible for Medicare. At that point, the system is built for you to transition to a new program called TRICARE for Life. But TRICARE for Life isn't automatic in the way you think. It's a benefit you have to unlock, and Medicare Part B is the key. Without it, you can't access TRICARE for Life. Many retirees think they can just opt out of Part B to save a little money on the monthly premium, believing their existing TRICARE will just keep going. That is completely false. The Department of Defense rules are crystal clear. To remain eligible for any TRICARE benefit after 65, you must be enrolled in both Medicare Part A and Medicare Part B. There are very few exceptions. If you fail to sign up for Part B, you will lose your TRICARE coverage.
Let's walk through what happens if you make this mistake. Picture this. You're coming up on your 65th birthday. You're getting mail about Medicare, but you toss it thinking, I've got TRICARE, I'm covered. Your 65th birthday arrives. A few months later, you go to a doctor's appointment or to fill a prescription. You hand over your military ID like you always have, but this time the claim is denied. The pharmacy tells you your coverage is inactive. You call TRICARE, and that's when the floor drops out from under you. A voice on the other end of the line tells you that because you didn't enroll in Medicare Part B, you were disenrolled from TRICARE. You no longer have health insurance, and the nightmare is just getting started. First, you are now uninsured. Any doctor visit, any prescription, any emergency is now 100% on you to pay out of pocket.
Second, you scramble to fix this. You call Social Security to enroll in Medicare Part B, but you've missed your initial enrollment period. Now you have to wait for the general enrollment period from January 1st to March 31st, and your coverage won't even start until the first of the month after you sign up. This could leave you with a massive coverage gap of many months or even over a year. Third, and this is the brutal part, you'll be hit with a Medicare Part B late enrollment penalty. For every single 12-month period you were eligible for Part B but didn't have it, your monthly premium will be 10% higher. If you wait 2 years, that's a 20% penalty. 5 years, a 50% penalty. This isn't a one-time fee. It is a lifelong penalty you will pay every single month for the rest of your life. A simple oversight has just become a permanent financial burden. And finally, you try to get your TRICARE back. While TRICARE loss isn't always irreversible, getting it back is not guaranteed and can be a complex process. Failing to enroll in Part B means you lose eligibility for TRICARE for Life. That premier benefit you earned through decades of service is now out of reach, all because of one missed deadline.
Now that you understand the stakes, let's focus on the simple, powerful solution. It all comes down to one single, non-negotiable principle. We'll call it the golden rule. The golden rule is this: to have TRICARE after age 65, you must be enrolled in both Medicare Part A and Medicare Part B. That's it. That is the fundamental action you have to take. When you do this, something incredible happens automatically. The day your Medicare Parts A and B coverage starts, your TRICARE benefits seamlessly transition into what is known as TRICARE for Life, or TFL. There are no separate enrollment forms for TFL and no enrollment fees. Your eligibility is simply updated in the Defense Enrollment Eligibility Reporting System, or DEERS, and your new coverage begins. Think of TRICARE for Life as your reward for following the golden rule.
This is a benefit you've earned. TFL is Medicare wraparound coverage, which means it works with Medicare to cover your healthcare costs. This combination provides incredibly comprehensive coverage, often leaving you with zero out-of-pocket expenses for services covered by both plans. You don't pay a premium for TRICARE for Life itself. Your only direct cost is the monthly premium for Medicare Part B, which is based on your income. For most retirees, Part A is premium free, assuming you or your spouse worked and paid Social Security taxes for at least 10 years. So let's be perfectly clear. The mistake isn't having TRICARE. The mistake is not understanding that to keep TRICARE in retirement, you absolutely must embrace Medicare.
So, how do you nail this and get it right? Here is your step-by-step action plan for a perfect transition. First, know when to enroll. You'll sign up for Medicare during your initial enrollment period. This is a 7-month window that starts 3 months before the month you turn 65, includes your birthday month, and ends 3 months after. But to avoid any gap in your TRICARE coverage, you cannot wait. The official recommendation is to sign up for Medicare at least 2 months before you turn 65. This ensures your Medicare Parts A and B are active on the first day of your 65th birthday month, the exact same day your old TRICARE plan ends and TRICARE for Life is set to begin. Second, know how to enroll. You enroll in Medicare through the Social Security Administration, not the DoD or TRICARE. The easiest way is to go online to ssa.gov. You can also call them or visit a local office.
When you enroll, you are signing up for both Medicare Part A, hospital insurance, and Part B, medical insurance. Even though Part A is typically premium free for retirees, you have to actively enroll in both. Part B has a monthly premium that can be adjusted based on your income. For 2026, the standard Part B premium is $202.90 per month, but this amount can change each year. While nobody loves another bill, that premium is the key that unlocks your comprehensive low-cost TFL coverage. Once you are enrolled in Parts A and B, you are done. There is nothing else you need to do. TFL activates automatically. Your new proof of coverage is simply your Medicare card and your military ID card.
So, what does healthcare look like with both Medicare and TRICARE for Life? It's an incredibly streamlined and powerful combination, but it depends on where you receive care. Let me show you exactly what this looks like in real life. If you go to a civilian doctor who accepts Medicare, Medicare is billed first and pays its portion. Then that claim is automatically sent to TRICARE for Life, which usually pays the remaining balance. In many cases, you may owe little to nothing for services covered by both programs. Now, if you choose to go to a VA facility instead, the VA handles your care directly. Medicare and TRICARE are not billed in that situation because the VA system operates separately. And here's the part most veterans don't realize. If the VA does not cover a service or you decide to receive care outside the VA system, you can use Medicare and TRICARE together instead.
So the key isn't which program you have, it's where you choose to receive care. That decision determines how your coverage works. When Medicare and TRICARE for Life are used together, Medicare pays first and TRICARE for Life acts as your secondary coverage, often covering remaining costs like deductibles and coinsurance for Medicare covered services. This is why TRICARE for Life is considered one of the strongest healthcare benefits available. It works similarly to a Medicare supplement plan, helping reduce out-of-pocket costs and giving you the flexibility to see any provider nationwide who accepts Medicare. You simply show your Medicare card and your military ID, and in most cases, the coordination happens automatically, giving you reliable, comprehensive coverage in retirement.
Let's quickly tackle a few common what if questions. First, what about prescription drugs? Do I need Medicare Part D? The answer is a clear no. Your TRICARE for Life coverage includes an excellent pharmacy benefit. You do not need to enroll in or pay for a separate Medicare Part D plan. Second, should I sign up for a Medicare Advantage plan, also known as Part C? For most military retirees, the combination of Original Medicare, Parts A and B, and TRICARE for Life is the most seamless and cost-effective route. While you can enroll in an Advantage plan, it often complicates things. The private plan becomes your primary coverage, and you may have to file claims manually with TRICARE for Life for reimbursement, which defeats the purpose of the automatic system.
Third, what happens to my spouse who isn't 65 yet? Your spouse and other eligible family members who are not yet 65 will stay on their current TRICARE Prime or Select plan until they become eligible for Medicare themselves. Your transition to TFL is an individual event and doesn't affect their coverage. Finally, what if I live or travel overseas? This is a huge advantage of TFL. Medicare generally doesn't cover you outside the United States. However, if you're overseas, TRICARE for Life becomes your primary payer, though you will have the standard TRICARE deductible and cost shares. The critical point is that you must still be enrolled in and paying for Medicare Part B to keep your TFL eligibility, even if you live abroad full time.
The transition to Medicare can feel overwhelming, but it doesn't have to be. By understanding that one critical rule, you must enroll in Medicare Part B to keep TRICARE, you are already ahead of the curve. You're protecting the benefits you rightfully earned. The single most important thing to take away from this video is this: sign up for Medicare Part A and Part B about 3 months before your 65th birthday. This one action prevents a catastrophic loss of coverage, saves you from lifelong financial penalties, and seamlessly activates your TRICARE for Life benefits. Navigating this can still bring up personal questions. If you want to be certain your specific situation is handled correctly, speaking with a professional who specializes in military retiree benefits can provide tremendous peace of mind. We have resources and links in the description below to help you.
Don't let a simple, avoidable mistake jeopardize your health and financial security in retirement. You earned these benefits. Now you know exactly how to protect them. Thank you for your service, and thank you for watching.